Okay, let's unpack something pretty vital today. Did you know that buildings in our cities can gobble up something like 40, maybe 45% of all the energy?
Right.
That's a huge source of greenhouse gases.
It really is a massive footprint. And that's exactly why this whole idea of green buildings is becoming so important.
Right.
Today, though, we're going to dig into a specific part of that. Green hospitals.
Yeah.
Maybe not the first thing people think of.
Exactly. So our mission for this deep dive is to pull out the key stuff from this research paper by Preeti Tarkar. It's all about the role green hospitals play in, sustainable construction. We
Hmm.
want to figure out what actually makes a hospital green, what the benefits are, and interestingly, some of the challenges too, which seem pretty
Yeah,
complex.
they are. So, okay, what is a green hospital?
Yeah.
Fundamentally, it's a place that aims to improve people's health, obviously, but also works constantly to reduce its own environmental impact.
So linking human health and planet health.
Precisely. It's about seeing that connection and applying sustainability thinking across the board. Where it's built, how it's designed, constructed, run, maintained, even how it's eventually taken down.
And the need seems huge because, well, healthcare uses a ton of energy, doesn't it? Hospitals are running 24/7 nonstop.
Nonstop. That means they pump out about 2.5 times more carbon emissions than your average commercial building. Plus, they use a vast amount of natural resources.
Wow. So greening them isn't just about like saving a bit of energy, it's a fundamental rethink.
Absolutely.
Yeah.
Especially for something so essential and always on. So how do they do it? Energy conservation is a big one. They have to be smart,
Right.
using renewables where possible, solar, wind, plus smart tech, sensors controlling temperature, lights, and efficient stuff like LEDs are way better than the old CFLs.
Makes sense. But it's not just electricity, is it? The building itself matters.
Oh, totally. Sustainable design is key. Things like using building materials from the region located near public transport, natural ventilation, planting trees, maybe green roofs, even capturing rainwater.
Okay, rainwater harvesting. And what about waste? Hospitals must generate a lot of that.
They do. So the focus is reduce, reuse, recycle. Simple principle, harder in practice. It involves things like buying supplies with less packaging.
Smart.
There's this cool example, the Embassy Medical Center in Colombo. They actually convert sewage into biomethane.
No way.
Yeah, and use that gas to help power the hospital. It's like a closed loop. Waste becomes fuel.
That's brilliant. And water use. You mentioned rainwater.
Yeah, hospitals use incredible amounts of water. So
Mhm.
green ones focus on reusing treated water for things you don't drink, like flushing toilets or irrigation. And that rainwater harvesting, like at the Samplavna Trust Clinic in Bhopal, they apparently meet their dry season needs that way.
Incredible. So what are the payoffs then? The benefits?
Well, there are tangible ones. Big savings. We're talking 20–30% less water use, maybe 30–40% less energy. That means lower bills, better economics.
That's significant money. Hard to argue with.
Definitely. But then there are the intangible benefits, too. Environmentally, you get better air and water quality, you help protect local ecosystems, biodiversity, less pollution overall.
So the building itself helps the environment around it.
Kind of, yeah. And socially, this is really interesting. There's evidence of better patient well-being, maybe faster recovery times, better hygiene.
Faster recovery.
Yeah, and just a healthier environment for everyone, inside patients, staff.
Hmm.
It can even mean fewer sick days for employees because the place is just more comfortable, better air, maybe nicer to be in.
Okay, so there are systems to actually measure this, right? Like rating systems.
Exactly, like guides and scorecards. In India, you've got GR, IGBC. Globally, maybe you've heard of LEED or BREEAM.
Yeah, LED sounds familiar.
Right. They provide a framework, basically. They certify hospitals based on hitting targets for energy, water, waste, where it's built, the indoor air quality. IGBC even has a specific one for green healthcare facilities with different levels like silver, gold, platinum.
Got it. But if it's so great, why isn't every new hospital green? You mentioned challenges.
Yeah, significant ones. Operationally, think about it, they have to run 24/7. Constant power, backup systems needed. That can clash with some sustainability goals.
True, like relying solely on solar power wouldn't work overnight.
Exactly. And infection control. Super important, obviously, but the strict rules often mean using harsh chemicals, lots of air changes that can work against being green.
I see the conflict.
Plus, they're just resource hogs. We said 2.5 times the emissions, but they use like 210% more electricity per square foot than other commercial buildings. And water, 80 to 150 gallons per bed per day.
Whoa.
Then there's the cost, often higher upfront investment. Hospitals renovate interiors fairly often, which is another challenge. And sometimes there just isn't huge demand from patients asking for green healthcare. Plus, in places like India, there aren't always laws forcing the issue.
So wrapping this up, it sounds like green hospitals are, well, definitely needed for environmental reasons. The benefits seem clear, but the hurdles are pretty high too. It's a concept worth pushing for, though.
Absolutely. It's a reality worth emulating, as the paper puts it.
Yeah.
What really stands out, I think, is seeing this push for sustainability in such a critical, nonstop industry like healthcare.
Yeah.
It makes you wonder how tackling these challenges could maybe pave the way for other sectors. And it really puts the spotlight on that balance, doesn't it? Between immediate critical needs and long-term environmental health. What strikes you most about trying to find that balance?